Hi, welcome back. Again, my name is Drew Giardina with Total Sports Therapy, and we're joined today for another community spotlight with Dr. Brandon Gough. Thank you for joining us.
Thanks for having me. I appreciate it.
So, once again, the point of the community spotlight is to introduce prominent physicians, specialists in their areas of field within the Valley, introduce them to people that maybe aren't aware of who they are, specifically patients that we've seen through our clinic practice as well, and just to try to get to know the physician a little bit more, get a little more information about what they specialize in and maybe some of the advancements that are going to be coming down the line. So we'll just kind of get it going real quick. If you don't mind, just kind of tell us a little bit about yourself, kind of how long you've been in Arizona, what brought you to Arizona.
Sure, yeah, and thanks for having me again. My name's Brandon Gough. I've been an orthopedic surgeon here in Arizona for about 10 years now. My specialty is specifically minimally invasive hip and knee replacement, and I love anything that has to do with technology. So I've been doing robotic surgery basically since I've been in Arizona, and I think that's what most people know me for. I came here to train under Dr. Headley, who I consider to be one of the greatest surgeons of all times. He's now been retired for about 6 months now. He asked me to stay on and be his partner because I was actually going to move to Minnesota. Thank God I didn't do that. But I ended up staying here as his partner, and probably the best decision I've ever made.
Yeah, I'm aware of Dr. Headley. He's been one of my rotations was with the PT practice that he was involved with quite a bit when they had the Institute of Bone and Joint.
Right.
Firestone and all those other guys
Yep.
were along with him. So, were you already practicing prior to moving to Arizona?
I did not. I did my residency in Wichita, Kansas, and then moved out here for my fellowship year with Dr. Headley.
Okay.
Again, with no plans to stay until he asked me, and I thought, well, why would I not stay?
Okay, nice. So I've got kind of a sort of an icebreaker question. It wasn't one I kind of prefaced by telling you in advance, but sort of I heard this on the radio. I thought it'd be kind of a good question to ask you.
Oh boy. Here we go. Let's do it.
Yeah, let's do it. Godzilla versus King Kong. Who's winning in a battle there?
I kind of feel like King Kong.
Okay.
I mean, I feel like he's way stronger than Godzilla and has a lot more dexterity. So, and probably smarter, right? Because, I think King Kong all the way. I don't know who wins in the movie.
I don't even know if that's even a thing.
Oh.
Yeah, it was just kind of one of those things where I think most people know both of those characters, and maybe have a sway one way or the other.
My money's on King Kong.
Yeah, I think he makes more money at the box office, although maybe not outside of the U.S. Was there anything in your history that kind of got you involved in medicine, or what made you specifically want to go along the lines of a surgeon?
It's interesting. So first of all, I did not think I was going to go to medical school at all. I went to college with the idea that I was going to do computers. My dad was a computer technician, and I thought, well, I'm going to be like my dad and do computers. And I remember my first class, my freshman year, was a computer class, and I think I lasted about 2 classes. Then I said, nope, not for me. And then I started to think, well, what else could I do? And I knew I liked biology because I'd taken that in high school. So I thought, well, okay, maybe I could try medicine. The question was, I didn't think I was smart enough to get in medical school. So I said, well, let me try. So I switched my major to pre-med, and I started taking classes, and I realized I just put the work in. I was going to do fine, and I started to really excel at those classes. And then fortunately was lucky enough to get into medical school almost last second at Creighton University in Omaha, Nebraska, which was great. And then actually was planning on being a cardiologist because I really liked the heart and the cardiovascular system. Very similar to how I originally started in college, I quickly realized that wasn't for me. When I started doing the rotations, to be honest with you, I was very, very bored on those rotations. It just wasn't exciting, and I thought, there's no way I could do this day in, day out. And up until then, I hadn't been in the operating room much. I had been on one rotation where I was in the operating room, and it was actually my gynecology rotation, where we were doing hysterectomies and stuff like that. And I just remember being in the OR and thinking, wow, the day's gone, and I've already worked 8 hours and I didn't even know it. So I knew at that point I liked the OR. I just didn't know if I could be a surgeon. And then somebody once said to me, hey, you should look into orthopedics. You're kind of a tall, athletic guy, and most orthopedic surgeons kind of fall in that category, or at least back then they did. So I did, and I watched my first hip replacement as a med student, and I thought, I'm in, 100%. This is for me. And then I realized, wow, it was one of the harder specialties to get into, and did I have the grades to get in, and did I have the board scores to get in? And fortunately I did, and the rest is history.
Oh, awesome. Yeah, it's boy, there's been a lot of my wife was in the cardiology side for a while, and there's been a lot of changes within cardiology in the last few years. Holy cow!
Yeah.
Probably made the right choice there. But
I'm pretty happy.
Yeah, yeah. Well, this valley is, I mean, I haven't done enough research, but there are a lot of great surgeons in the valley, and I think a lot of people come here for that reason. I know a lot of the Canadians wait to come down for those surgeries. I'm sure you get a fair amount. Now, along the lines of the specialty, working with the robotics and the joint replacements, do you see any new changes coming down the line anytime soon, or what's the next newest thing in regards to the robotics?
Yeah, no, I'm glad you asked that, because actually I'm currently investigating augmented reality for hip replacement. I do robotics strictly on the knees. I don't do it on the hips for one reason and one reason only, because I can't work the robot in my small incision for my hips. And I'm not willing to sacrifice tissue exposure and dissection to get this robotic arm in there, and I don't think it's going to give me an advantage. But augmented reality, I think, is the wave of the future, especially for hips, because if we can strip away all the soft tissue and just get a bony model looking through our lenses, and get a really good look at the patient's bony anatomy, and be able to position the implants perfectly and restore offset and leg length through our augmented reality goggles, I think that's the way to go. And then you could keep your incision small and do a minimally invasive approach. Currently, there's one FDA licensed technique with that, and I'm currently looking into it, and hopefully we'll get to try it or at least preview it here in the next couple months.
So that make sure I understand this. The goggles are creating the reality of the deep joint without having to expose it surgically?
Yeah, so that's the idea behind it. Is what it looks like is that you strip away the soft tissue so you can get look at the bony anatomy. And I haven't seen this product yet. I've only seen some videos about it, but we fortunately know the guy who invented it, myself and my partner. So hopefully we're going to be able to try it out here, or at least look and see if it's something that's feasible for what we're doing.
Oh.
But regardless whether that one works or not, the future is definitely, I think, this augmented reality landscape. I know multiple implant manufacturers are developing this technique, and I'm hopefully going to be able to help develop this technique with one of the implant manufacturers. I'm a consultant from one of them, so we'll see if that works.
Oh, interesting. Well, I could see the benefit from the therapy side of that too. Obviously, the less you have any wear or tear to the soft tissue, the easier the recoveries are going to be after the fact as well. Kind of moving into the realm of what you deal with as far as the knees and the hips, just kind of briefly, if you can, just sort of delve into what kind of symptoms a patient, a person might be experiencing that would potentially put them in the realm of coming in to see you.
Yeah, honestly, I think this applies a lot to the hip, because the hip's very confusing, right? I've seen people who have had terrible hips and get diagnosed with back pain for years and years, and their hips went overlooked. And so what I'll tell people that are watching this is if you have groin pain, specifically in the front of your hips, it can be on the side and the back, but typically it's in the front. It almost feels like a groin pull is what people often describe. That's probably something going on inside your hip joint, and maybe you should get that checked out to see if you have some hip arthritis, or maybe even a torn labrum, which is a soft tissue structure inside the hip. So I think that's something that people need to be aware of, specifically front-sided groin pain. That's a key indicator that potentially something's wrong with the hips. Knees are a lot more straightforward. Usually that hurts directly in the knee. Sometimes it's behind the knee, the sides of the knee, and usually that's kind of a sharp pain or even some clicking or popping. But that's a lot more straightforward. I think the hips are the one that people get confused with a lot, and I would urge people to really look into that if you're having groin pain or even stiffness where you have trouble putting socks and shoes on. How many patients have you seen that can't put socks and shoes on? You're like, your hip's bad.
Yeah.
And they didn't even know, right? Yeah. So those sort of things.
Yeah, I mean, that's definitely, most people, if they don't have a clue regarding hip replacements, it's everybody, 90% of the people think the hip is on the outside, you know, where the
Right.
trochanter is, and then you say, no, it's in the groin, or they misdiagnose it with a groin pull that's chronic and never seems to get any better. Um,
Yep.
You know, you know, in another spotlight we did too, it kind of came up, the thing I urge people that might be watching this as well is, you know, the thought of having to go through a knee or hip replacement is super daunting for people, and we'll get patients in that have come to therapy but haven't seen necessarily a surgeon like yourself. And you know, my recommendation is you know, the outcomes of these things are, when you go to a quality surgeon like yourself, are so much more predictable. I mean, with each year they get to become more predictable, and don't lose years of your life avoiding something that ultimately you're going to need. And those 3 years you waited, you could have had a better quality of life
Right.
going back to what you're trying to do.
You're 100% right. At the end of the day, this is a quality of life procedure. So I feel like if you wait till you can't walk or do certain things, you wasted all that time. And we have such great technology now. You know, I tell most of my patients, we expect 30 years out of these implants. And so why not, you know, enjoy the more active, younger years of your life when we can fix your knee or hip. And then, you know, when you're 80, it doesn't matter as much. But you're right. It's a quality of life procedure, and that's what we do, is we help quality of life.
Yeah, and that goes back to I mean, that's one of the first things I tell people too is as soon as you find that you can't move, whether it be tying your shoes, and maybe that's not the last indicator, but certainly when the gait and people can't walk in a normal way on a daily basis, that's when I'm like, okay, you got to, you know, that's only going to be a harder thing to fix, you know, after the fact. You know, with the minimally invasive hips now, people coming in and they don't lose a ton of strength, but man, if that gait is messed up, that's the hardest thing to fix.
Right.
Because there isn't a single exercise to correct a gait abnormality. It's a lot of factors. So, another question we've asked some other physicians we've done these videos with is, if you'd have, how you would respond to aspiring potential med student coming to you in terms of saying, hey, what do you think about getting into the medical field? You know, with cost of education these days, you know, the COVID risk, those kinds of things. You know, any advice you might have for somebody looking along those lines?
You know, that is actually a hard question to answer, because I think we all ultimately go into this field because we know we can help people. You know, in my specialty, yours, but every one of us, we can help people and make their lives better. But it does come with some sacrifice, right? I mean, I didn't start working, I gave up my entire 20s. When all my friends were out, they had a job, they were making good money, and I could barely even afford to go to Target and buy some ramen. My entire 20s, because I had no money and I was in debt. So, you know, I think the value of our job and coming to work every day and knowing that you can help people is worth it in the end. But it's not Grey's Anatomy. It's, you know, there's not some theme song playing in the background every time you're helping a patient. And some days are better than others. Some days, you know, your patients are doing really well, and sometimes they're not. And it's really nothing at the end of the day usually that has to do with you. It's just anatomy is different with everyone, and everyone heals differently. So stick to your guns, and, you know, hopefully the cost, I think the big thing is the cost, right? The cost of getting this education, and who knows what's going to happen in the next 5 to 10 years with that. I know it was very expensive when I went through, you know, 15 years ago. But at the end of the day, coming in and knowing you can help people, and when my patient tells me they want to give me a hug and they start crying because I gave them their life back, that's one of the best things in the world. It really is.
It's a very, I mean, that's kind of been a common theme of the answer as well too. I know for myself, it's you know, being able to meet a lot of different people, and the challenge of the different, because while the anatomy is the same, a lot of things can be different between people, and the challenge of working with different people, and you know, the appreciation you get is great, but also the personal pride that you can take in trying to help somebody get better is part of it as well. You
Right.
know, so I kind of touching back on that COVID, is there, the realm's kind of changing, is, a year and a half ago wouldn't have been anything we would have brought up, but is there, anything that you would recommend or tell patients that might have a little bit of hesitancy with wanting to come to a medical facility, potentially having surgery due to COVID reasons?
So yeah, I mean, that's a great question. The nice thing is, because of the techniques that I've been trained in, this minimally invasive techniques, we've been actually able to take care of patients the entire time throughout this COVID process, because we basically get patients in and out of the hospital very fast. You don't even need to stay the night anymore, essentially, for 95% of our patients. So your risk for getting COVID is almost nothing. I mean, you're not even around sick people. You get in, you get your surgery, you get your physical therapy while you're there for a couple hours, and you go home and recover in your home, which I think is great for patients. And I think for guys like myself and my partners and a couple other guys here in town that are trained in this kind of technique, we never really saw a decrease in business during this whole time, because we were able to get patients moving. Now, if you're doing something more traditional and you have to stay in the hospital for days on end, clearly that's an issue, right? Because the longer you're in the hospital, you're around more sick people. So I think we operated the entire time through COVID, except for the 6 weeks we were told we weren't allowed to, and we never had one single issue with any of our patients getting COVID, or any issue at all, to be honest with you. We've got pretty good protocols in place. Everyone, at the hospital and our clinic are wearing masks when around patients, and so yeah, I think it's. I try to tell all my patients the risk is extremely small that there's an issue with that.
Yeah, I would agree. We had a 2-month period where everybody was kind of freaked out, surgery stopped, but then basically from a year ago, it's been the same moving forward, and same protocols, just even though the states opened up, it's, we're still kind of following the CDC guidelines with all that stuff, and
right.
Moving along the lines as far as that's concerned. So I mean, that's all good stuff. Kind of lastly here, say you do, patient comes in to see you, what would you say are some of the time frames for people kind of getting back to normal activity, either both from a hip standpoint, hip replacement, as opposed to a knee replacement? Typically?
Yeah, so I typically tell people, so for instance, my knee patients, if they're going to have a knee replacement, I say generally at 6 weeks you're somewhere around 80%, plus or minus, right? Could be plus or could be minus, hopefully the plus side. And obviously it depends on the history of the knee, and was there surgery in the past and that sort of thing, and deformity correction and that sort of thing. And then the last 20% can take anywhere from 1 to 5 months. I'm sure you've seen that when you're recovering these patients as well, because knees can be finicky.
Yeah.
Even though we're doing all this fancy stuff with not cutting muscle and robotic assisted surgery, it still can be a longer recovery than myself and the patient and you want for the patient. Hips are a different ball game. Hips, I tell everyone, at 6 weeks you're probably 90%, and then the next 10% is pretty quick. Honestly, at 6 weeks, most of the hips are pretty much, they feel like they're recovered.
Yeah.
So it is a big difference between the two. And honestly, we have knee patients that say the same thing, but I never try to promise that, because knees, I never know. Knees can be a bear sometimes.
Yeah, I would agree. It's usually you can, from my standpoint, I can figure that out within the first week to 2 weeks they're in therapy, how it's going to go. And that's even if if they've had home therapy, by the time I see them, I can tell you the first day how it's going to go. Whether based on the patient's pain tolerance, how quickly they're developing scar tissue, age, is part of it. So, but
yeah,
okay.
honestly, that I don't even recommend home therapy for that reason.
Yeah.
I recommend going right to outpatient therapy, go see you, and immediately within 3 to 4 days of surgery, I think the patient's ultimately going to do better in your hands, in your facility, than if you were to come to their house or any other therapist goes to their house, because it's just, I like the idea of the patient have something to do that day. Like, I have to get up, I have to go to therapy, I have to leave my house today. It kind of gets them out of that sick mode,
Yeah, and it's just like you have quality surgeons, you have quality therapists, quality home therapists. More and more, there just isn't as much being done, it seems like, in the home.
No.
And so people come and they haven't really been doing a lot. Are you, out of curiosity, what percentage of your knee caseload would you say is being done on an outpatient basis?
I mean, since COVID, probably 95%.
Yeah.
Very rarely do I have people stay the night anymore. I mean, we did 6 surgeries yesterday. All 6 went home yesterday.
Yeah.
You know, it's half hips, half knees. That's the greatest thing, is you just don't need to be in the hospital anymore. When I was in training, it was 4 or 5 nights in the hospital, a walker for 6 weeks, and not even the same.
Yeah, yeah, it's good to see. So, all right, well, that's all good information. And once again, thank you for joining us. This is another presentation of the Community Spotlight. If you want to look, we'll be putting information on the screen on where you can find Dr. Brandon Gough, schedule with him, information on that, as well as more information regarding total sports therapy. And hope you can join us again for the next video that we do, spotlighting another prominent physician in the Valley. Thank you.